Good afternoon. I want to welcome everyone today to our weekly update from the Lake Cumberland District Health Department to talk about COVID-19. We have some members of our executive staff team that will be answering questions. But we're going to start off with Amy and let you give an update from last week to this week regarding COVID-19 across the district.
Hi, everybody. This is Amy Tomlinson, Preparedness Manager for Lake Cumberland District Health Department. Just going to give you a quick update on our cases. I'm going to tell you the active cases and the recovery cases for each county, and then our total, what we're looking at across the district. So we're looking at 32 active cases in Adair County, with 88 being recovered in Adair for a total of 139 total Adair cases. Casey has 24 active cases, 15 recovered for a total of 40. Clinton County has 1 active case, 6 recovered for a total of 7. Cumberland has 0 active cases, 6 recovered for a total of 6 cases. Greene County has 4 active cases, 4 recovered for a total of 9 cases. They've had 1 death. I didn't report the deaths in Adair County, but they have had a total of 19 deaths in Adair County. McCreary County has 0 active cases, 18 recovered or released cases for a total of 18 cases in their county. Pulaski has 28 active cases, 89 have been recovered or released. We've had 2 deaths in Pulaski County for a total of 119 cases. Russell has a total of 20 active cases, 37 recovered, 4 deaths for Russell County for a total of 61 cases. Taylor County has 11 active cases, 36 have been recovered, 1 death for a total of 48 cases. Wayne County has 5 active cases, 14 recovered, and 0 deaths for a total of 19 cases. So across the district, our totals for today look like 125 total active cases. Of those, 117 of the 125 are isolated at home, and 8 of those are hospitalized. We've released 313 cases. We have had 28 total deaths, and we have had a total of 466 cases reported. I will say that we are looking at least 8 additional cases that we're working on today that will be reported, possibly more. There's a couple of pending things out there. So our cases will go up. Of course, we've seen an increase in cases the last few weeks, and especially the last few days. I was looking earlier at our case counts, and from Sunday till Wednesday last week, I think we had 29 cases reported, and from Sunday to Wednesday of this week, we've already had, I think, 39 or 40 cases reported. So we're on pace to exceed what we did last week. The 125 active cases that we're seeing is our highest active case count that we've had since COVID began. We have had this week a long-term care in Casey County that has had an outbreak, and we're looking at some residents and staff affected there. We're working very closely with them to prepare them and help them in any way that we can. Casey, I'll turn it back to you.
Thank you for the update. If you have questions, please type that in the chat box, and we'll do our best to answer those as we walk through the meeting today. And I will start with the questions that I currently have. Stuart, I think the first one is for you. I was in a church service which was attempting social distancing, but no one was wearing a mask. Someone in the church tested positive, and I was told to self-isolate along with most of the congregation. If everyone in the church had been wearing masks, would we have had to self-isolate?
Okay, so one thing you'll notice today with the questions, we do kind of have a theme. All these questions revolve around contact tracing and isolation. So to answer the question about the church service where a person had attempted social distancing, but no one was wearing a mask, and what would have happened if they had been? Still, you would have had to been quarantined, but the risk of being infected would have been a whole lot less, and we can't quantify that risk. I mean, we're not sure what that risk would be. So it's a precaution that we quarantine. We know that wearing a mask and distancing that's what helps prevent the spread of the virus. And ultimately, in a setting like a church, it's what helps prevent an outbreak. Now, you may still be considered a contact because you've been in a confined space for a amount of time. So that still may be true, but you have reduced your risk of contracting COVID or having an outbreak by following the guidance of the masking and the distancing.
Okay, thank you, Stuart. I think the next question is going to be for you also. How long will someone that has tested positive after symptoms have cleared? Sorry, I misread that.
Would you like me to answer that?
Yes, Dr. Wayman, I would. I would.
Okay. So from many studies, it's been shown that people who have recovered can sometimes still be positive by the test that we use for the PCR of the RNA. And this is because there are non-viable virus particles that are still remaining and therefore testing positive. That is providing the person is recovered. When they have no symptoms, this is probably the reason why they are still testing positive.
Thank you, Dr. Wayman. Next question. My son's friend that goes to the gym has tested positive. Does my son need to be tested?
Okay, so the son's friend that he goes to the gym with has tested positive. So now does your son need to be tested? So a person can, if they're symptomatic, then yes, of course, they should be tested. If it's been 45 days since his contact, then he could be tested. But even if the result is negative, then it's only negative on that day. That's a point in time test. And it could be positive the next day. So if there's exposure, then the son would be considered a contact and would have to quarantine for the 14 days. So an exposure now is if you've been in contact with a positive case, you've been within 6 feet for 10 minutes or more, then that is when you would be considered a contact, you'd be considered exposed, and you can become symptomatic anytime up to the 14 days.
Here's another question about someone who's been around someone. My daughter's friend's sister tested positive. Do we need to quarantine?
Okay, so on this one, this is where we start talking about potentially a secondary contact. So what I mean by that is if you're a contact of a known case, you're a primary contact. If you are a contact of a contact, not a contact of a case, then that's a secondary contact. In that case, no. You only are quarantined if you're in contact with the case. Otherwise, you're not. If you're only in contact with somebody who's been in contact, you're not necessarily quarantined. So.
Okay, thank you, Stuart. Next question is yours, I think, Dr. Wayman. Do you think we're seeing more youth and young adults being tested positive for COVID-19 in the last weeks versus the older population?
Compared to the beginning of this outbreak, yes, we are seeing more youth and young adults, but they are still in a minority. Approximately 6% of our cases are younger than 18.
Okay, thank you, Dr. Wayman. Next question. How are the asymptomatic cases reported across the district?
Oh. I think the question says, why are they being tested effectively? Some of the people are being tested because they are preoperative, some because they've been in contact to other cases, and some because they just wanted to be tested. So we have a variety of reasons why get tested and are found to be positive.
Thank you. Okay, the next question is the 1.03 number in the data from our information from the public information brief right for our number? And this came from Russell County.
So the R0 number, which is calculated on the number of cases and active cases, is a number which predicts how many, yes, that is correct, the answer to that question. And it signifies that for every one case, that one case will infect 1.03 other people. So the higher the number, the more exposure and transmission there is in the community.
Thank you, Dr. Lyman. Next question. What is the difference in a case and a contact?
A case is somebody that has symptoms and has a test that's positive for COVID-19, and a contact is somebody that was around that person and has possibly been infected.
Okay.
The contact means that they've been around that person for at least 10 minutes or more within 6 feet in an enclosed space, usually.
All right. We have a couple of questions from YouTube Live, and I'm going to go to those questions real quick. The first question says, what is the bed capacity at the hospital in Pulaski County should it come to an outbreak with numerous people requiring hospitalization? And what is the bed vent capacity for the more severe cases?
Amy, is that?
Say again, Tracy, I'm sorry. I was looking up another question.
Okay. What is the bed capacity at the hospital in Pulaski County should it come to an outbreak with numerous people requiring hospitalization? And what is the bed vent capacity for the most severe cases?
That's a question for the hospital, I think. We monitor that information. I don't know that I'm at liberty to share their numbers since that's their facility. We monitor it. They have quite a robust capability over there, and they have capability to transform non-traditional areas even into COVID spaces if it were needed. And we have not, across our district at this time, seen any kind of case hospitalization rates that have been anywhere near the capacity that our region has. We are not in danger at this point of exceeding our capabilities within the region, either for COVID beds and placement for patients or ventilators.
Okay, thank you. There's another question also. Is there any discussion within the Lake Cumberland District or from the governor's office that wearing a mask could be mandated soon in public?
We're not aware of any of those discussions right now. There are no discussions at this time within the Lake Cumberland District Health Department, and I'm not aware of any discussions at the governor's office at this time. Of course, discussions at the governor's office, we may not be privy to those, so I'm not saying that they may be happening, but we're just not we're not privy to those discussions at this time.
Okay, thank you, Stuart. Next question is yours, Dr. Wayman. How is contact tracing done in the Lake Cumberland area?
Once we receive a report of a case, we contact that case and gather some information as to their symptoms and symptom onset. And from that, we calculate who the contacts could be, that is, the people that spent the time while this person was most infectious, which is 2 days before symptom onset and for some time afterwards. Then we contact those people by phone and we interview them and advise them on quarantine and monitoring symptoms. And should they have any, they will contact us.
Okay, thank you. Next question. What are the challenges that you run into during contact tracing?
Well, the biggest challenge is if we happen to have a lot of contacts, like 50 or 100, that means a lot of phone calls and a lot of hours by our staff That's probably the big one. Generally, we can get hold of most people, so that's not an issue. That's all I can think of. Anybody else?
Okay. What are the reactions of most people to your contact tracing, and are they complying with your request?
Most people are very happy. I don't know about very happy, but they comply. They seem to understand the situation and do not cause us any problems.
Why is contact tracing so effective, and what is the expected results of vigorous contact tracing?
Contact tracing is effective because people who will be cases are infectious 2 days before they have symptoms, or for that matter, they could be infectious even though they're asymptomatic. So if we can quarantine somebody who's actually being exposed, we prevent the transmission of any possible virus. And keeping them isolated for 14 days rules out anybody that we haven't picked up who becomes a case.
Okay. What is the average number of contacts of a case in Lake Cumberland? And then how many cases has the health department investigated to date? And how many contacts have those cases resulted in?
Lots of questions. Okay, so we have had 466 cases, and till the 7th of this month, the average number of contacts has been 7. We have called and quarantined almost 3,000 contacts. Majority of the cases are linked to another case within, I don't know if I'm saying this right, are linked to our other cases. So 65% are connected, either through long-term care, churches, employment, and only a few cases, a third of our cases, have no known exposure within our realm. They obviously were exposed somewhere, we just don't know where.
Wow, a lot of contacts, connections made out there. Okay, I don't see any other questions in the comment box, but I'm going to wait just a few minutes and ask people if they do want to put some questions in there to please go ahead and do that. Do you all have any other comments you want to make, Stuart, Dr. Wayman?
Tracy, I think we skipped over a question, number 6 on your paper.
I'm sorry. Oh, I apologize. Yes, that's yours too, Stuart. My bad. If someone has COVID-19 but are not showing symptoms, they're asymptomatic, is the chance greater or smaller that they could pass it on to the general population than someone who does not have symptoms?
Okay, so the chance of an asymptomatic person spreading the virus is going to be very high because that person is not sick and that person doesn't know that they have the virus. This person then in turn may feel like that they don't need to wear a mask, or they don't need to avoid people by social distancing, or they don't need to avoid mass gatherings because they're not sick. However, being asymptomatic, they can still be shedding the virus, and when they do these risky behaviors, then they're spreading it to others. And also, we assume that people who are not coughing transmit the virus less. So, I mean, you do have some give and take there. So they're asymptomatic, they're not coughing, so hopefully they're not discharging that virus as much, but they are out and they may be involved in some of this riskier behavior and doing some things that they shouldn't be, thus exposing some people that they are around. And I did want to go and make one a comment today. So we're talking about contact tracing, and now you may experience when you go out to eat in a restaurant might ask you, they might ask you for your time in to the restaurant. They may document that. They may get your contact information, and all that is for contact tracing. So if you are in a business, in a place like a restaurant, you're dining, and possibly there's a waitress or somebody around you, an employee there that becomes positive, and you've been there and you're a contact, what that helps us do is to trace those people down and to determine what kind of exposure they had and whether they need quarantined or not. It also helps us to not have to put out a media release to say, if you ate at such and such restaurant on this date, you know, please contact the health department. That's going to be really hard for us to try and straighten all that stuff out. Also, if you attend a event like a fair or anything like that, we're asking those people now that they register the attendees, either by selling tickets or a registration process. Again, so if we have positive cases at that event, we can do the contact tracing if need be with those people who may have come in contact with that. So it is important to comply with those requests from certain dining locations or events.
So that's something good to know, Stuart, for people who are planning on going places or doing things, if they're asked for that information, not just to be aware that they're doing it for their protection in a sense in the future. So
yes, that's correct.
All right. Any other thoughts or comments from you all before we close out? Amy, I'm going to let you.
Laura, our director of nursing, asked me to mention that she's gotten some misinformation, some information shared with her that she thought was maybe out there that she wanted to clarify about our case counts and about how sometimes people think that we are counting in that 466 number or whatever our total cases are. Those are truly lab confirmed cases that we have documentation on and are truly cases. Sometimes if a case comes in and then it's a household of, say, 5, there's one case that gets added that day onto our numbers, but there's potentially 5 people in that household. And some people think that we report all of those in that number for that day, and that's not true. They become quarantined, asked to stay home, and they are a contact of that case. But then if they turn positive and have a lab report or whatever at some point in the future, they will be added. But our 466 are truly lab confirmed cases, and we're not double counting those numbers.
And the other thing is, if a case gets tested again and is found to be positive towards the end of their recovery, we do not count that. We only count unduplicated numbers.
Okay.
Please wear your mask and be socially distanced and avoid the gatherings. Our numbers are not going down. They are not going down. So if you believe that cases are going down, at least in our area, that is not true. Our cases are increasing. So be vigilant and follow the guidance.
I don't see any other questions. Amy, is there something you want to say before we close out?
I just want to thank everyone for joining us. And like Stuart said, make sure that you're wearing your mask. That's going to be our best protection in order to keep our economies open and businesses opened and to keep things moving as well as we can through this endeavor. Just have patience with each other. There's a lot going on in the world right now with COVID and many other things. And I think we just all need to be patient with each other and get through this together. Thank you, Tracy.
Thank you all. I want to remind you all that we will be back next week, Wednesday at 2 o'clock. If you have questions, please send them our way. Thank you all. Have a good day.